My name is Dr Stephen Pillinger. I'm a colorectal surgeon at the Sydney Adventist Hospital. We all think we live in a unique period of time, but I think from a surgeon's point of view who's of my young age, I have had the benefit of coming through a largely open surgical practice, transitioning into laparoscopic surgery and now transitioning into robotic surgery. So I have had the benefit of seeing a lot of procedures done with all three approaches. Open surgery is the traditional way of accessing any body cavity, particularly in my field, the abdomen. And one of the issues that's difficult for people to understand is how much better a view we get with particularly robotic surgery than you actually do with open surgery. And that's a simple way of thinking about that is if you are opening the abdomen, your eyes are at least 30 to 40 centimetres away from the target anatomy. With robotic surgery, you can be within 1.5 centimetres of what you want to look at with tenfold magnification. And I don't care how young or how good your eyes are, you can't get a better view than that. With open surgery, when you're dividing the midline fascia of the abdomen, there are enormous problems down the line. You get a very high rate of incisional hernia where the muscle doesn't heal properly, and that leads to obvious problems for patients with discomfort, a very unaesthetic looking abdomen. You know, people are embarrassed to wear swimming costumes. They get enormous problems with incisional hernias, which largely go unreported because people don't want to look at another big operation to fix that. Wound infections, once they are established, and we hear in the media how big a problem bad infections are and infections that can't be treated these days. Once you get an infection in a large wound, that's a potential disaster for patients, leading to often months in hospital dealing with those issues. Obviously, large incisions are much more painful, so you're in hospital for longer. It takes a long time to return to your normal activities. The other physiological aspect of this is we don't understand how that interferes with the mechanics of your abdominal wall. So if you're someone who uses your hands for a living, mechanic or a builder or a plasterer or somebody like that, if we interfere with the mechanics of your abdomen, it may well have a severe impact on your ability to work normally once you've recovered from your operation. And these are questions that simply aren't looked at closely enough. With laparoscopic surgery, we overcome a lot of those difficulties associated with open surgery in that laparoscopic surgery is what people know as keyhole surgery, with very small 5 to 12 centimetre incisions. Cameras pass through into the body cavity, the abdomen that you want to access, with small instruments, colloquially known as chopstick surgery because they are stiff instruments that allow you to do the procedure. And that's a huge advance and benefits patients enormously. Those benefits are very well known in terms of less pain, quicker recovery, quicker return of bowel function, quicker return to normal activities. But it does come at a cost in that you have obviously less ability to manipulate tissue because you're using small instruments rather than your hands, and it is more difficult to access where you need to get to. But with experience, you can do a lot with laparoscopic surgery. What you don't realise, or what people often don't realise, is the cost you pay for that sort of access. And the cost for the surgeon is enormous. Ergonomically, it's a very damaging way to operate. Surgeons get a lot of neck, shoulder and arm injuries with prolonged laparoscopic careers, and this is becoming more and more appreciated. So surgeons' working lives are probably shortened by laparoscopic surgery rather than lengthened. With robotic surgery, a lot of those disadvantages are overcome because robotic surgery really is like laparoscopic surgery on steroids. You know, the robot is holding the instruments for you and it will never move unless told to do so. It's holding the camera, so everything is rock solid. You don't have a fatiguing assistant holding your camera, and the disadvantages of being in abnormal positions while you're holding laparoscopic instruments are done away with completely. So your surgeon is relaxed, they're focused, they're not worried about the pain in their neck, their wrist, their elbow while they're doing their procedure, and they're completely focused on doing the job that needs to be done. So the advantages for both patient and surgeon in that situation are obvious. In terms of the actual mechanics of doing the procedure, the ability to manipulate tissue because of the strength of the robotic instruments is far superior to laparoscopic surgery. It does take a long time for clinical benefits to be proven with what we all like to call evidence-based medicine these days, because the differences are small, but they are real, and the data will just come with time.